Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring another series of interviews with top leaders in health IT. And our guest today is Ajay Kapare. He's president and CEO at ELLKAY. Welcome, Ajay.
Well, thank you so much for having me here, John. And I know this is your hometown. And, we meet all the places and rarely we meet actually in your hometown. So I'm very excited to see you here.
Yeah, I'm excited to have you on. I've only tried for how many years to get you on here. We've had a lot of ELLKAY people, and I'm so grateful that you came over to talk about all the good work you're doing at ELLKAY and what's happening in the industry. But before we dive into that, tell us a little bit about yourself and ELLKAY.
Well, I'm Ajay Kapare. I'm the president and CEO with ELLKAY. I've been with ELLKAY for 7.5 years now. ELLKAY as a company, we are interop solution provider company. We are in 5 segments of healthcare, ambulatory, clinical labs. Then we are also in health system, payers, and also we do interoperability for other vendors. And, slowly we are also getting into data and life science too.
Wow.
So very excited about the work that we've been doing last few years.
That's awesome. Well, we're slowly getting into life sciences too. We have an announcement coming as well. But so I guess we'll be working a lot more together.
Yeah.
You had a big announcement yesterday. They just came down, leading into HIMSS. You're now a president and CEO at ELLKAY, so congratulations on your new role. What would you say excites you most about leading ELLKAY and into kind of this next chapter of everything you're doing?
Well, thank you, John. And I'll tell you what excites me most is the people. I really feel the people in our healthcare IT industry, people that I work with at ELLKAY, every day I get to work with some of the finest people. All of us, we had a choice in our career, but we all chose healthcare. And the reason we are in healthcare, because we all want to make sure that, we take care of that patient, we take care of the patient experience. I always tell my team and I always tell everyone, we are in the business of saving lives in one way or another. And that itself is a pretty big reason, and that motivates me the most actually, to be getting up in the morning and meeting the right people and learning from everyone.
That's awesome. Well, I saw as part of the announcement many of your team members celebrating you, and you could see that they truly cared about you, and they truly felt cared about by you, which I think that's a powerful thing that you've done as a leader at ELLKAY. So that's pretty awesome. What values or principles do you think will guide your leadership style as you lead the organization?
I think it all comes to people. You got to hire people, but then, you got to actually make them show the path, let them actually work, give them the freedom and trust them. Trust is very important. The work that they are doing, the heart that they're putting in, if you back them up, you can actually see that, ELLKAY has been growing 7 years in a row. And one of the primary reason is the people who work with us. It's not just work, but people feel like, they need to contribute towards the community, towards the healthcare. And that feeling will only come when you actually back them up with their ideas. No idea is good or bad idea. I always say it's an idea. We should look at it and then you should execute and you should have a plan.
Sure.
And that has been the main difference that, I always feel like as a part of leadership, I've always worked around with more smarter people than me, and they have told me what to do, and you just go with that, and it has worked for us.
Yeah, no, I think it makes sense to support the people around you. It doesn't make sense to hire smart people and then tell them what to do.
Very true.
I love that. I've seen the ELLKAY journey. I remember early ELLKAY days, you were doing EHR conversions, and you've evolved into full interoperability and really a full, data partner across the healthcare ecosystem. What do you think is the key to standing out as that key data partner for healthcare organizations?
I think the biggest thing that I feel is accountability. I think, once we close a deal, I think, the number one thing is that, you got to actually promise less, deliver more, or promise what you can actually deliver. And I don't think your job is done once the deal is closed. After that, the real work starts. And the real work is how do you plan? And at the start of the project, it's really the accountability, a client's accountability. And we call our clients more like a partners here, and it's a collaboration. And if you can actually hold each other accountable, you're going to have good days and not so good days. It's really in not so good days how you really look and how you react and how much patience you can keep to it. The biggest thing is listening. I really feel listening is one skill set. Listen to your customer, listen to your people, listen to what works, what doesn't work, and have an open communication. And I feel like when you have this open dialogue, that definitely differentiates LK with everyone else. We have no problem talking about good or not so good things and learn from it.
Yeah. Well, here at HIMSS in the health IT world, we know that there's a data-driven future for every healthcare organization. Talk about how LK is helping organizations prepare for that future.
So LK as a company, if you look at it, we have over 300 health systems today, 22,000 physician offices who have worked with us. We have over 600 clinical labs who have worked with us. And then we are also in the payer space now. On the interoperability space, Commonwealth actually is using LK's platform now.
Yep.
When you look at all those pieces, data, the source of the data, and then getting the quality of the data is extremely important. Otherwise, it's very easy that, all the initiatives going around, very recently I met with a group of people who are launching their AI initiatives. But if the source of data is not correct, your initiatives are not going to work. It will become like, garbage in, garbage out. And I personally feel like, source of the data, the richness of the data, and the format of the data, if you can actually bring it at the right time, with the right applications, we are going to see a humongous actually upside that the healthcare needs to look at. And I think LK is at a very good place where we can actually do that and work with everyone, collaborate with everyone, with our partners, and make that difference.
Yeah, that's awesome. Well, HIMSS is highlighting a lot of themes. AI, of course, interoperability, digital transformation, a lot of topics being discussed here. Talk about how the work you do with healthcare customers kind of fits into these themes that we're talking about at the conference.
Yeah, I think, we, LK as a company, as I said, we are in the interop solution provider company, but we are moving towards becoming the enterprise data management company. With our work on the archiving side in the health system, when they're switching their EMR or upgrading their EMRs, in the physician offices, all the things that we do with numerous EMR partners that we have, and we work with 200 different EMRs with 1,200 different versions. There are that many.
Yeah.
And as we do this work, we know the data sources, how to get the data out, what are the data silos out there, what are some of the things that they need to prepare. And when you talk about AI, interoperability, I feel like, LK as a company, the way we are actually supporting and surrounding ourselves with all the things around, we are that trusted partner where we can actually make their initiatives a reality.
Yeah.
And the more and more actually health system CIOs or other CIOs that I meet, this collaboration, this whiteboarding that we do with them, it has helped us to push ourselves a little bit more. It has made us think differently, and we are showcasing some of our solutions. A couple of our solutions out here are LKOpera, which is a very big launch that we did last year, and we have seen tremendous response around it. And I'll love to actually talk more about that one day with you.
Yeah. No, I think that's what's interesting is there's so much opportunity with the data that's out there. But the question is, how do we leverage it? And is the data trustworthy?
Yeah.
And you even have a session kind of talking about this, your AI strategy and kind of the role of data integrity and validity in that AI strategy. Why is this so important for AI, to have clean, healthy data?
And, John, if we don't talk on AI, it's not a conference, right? I feel like, we are doing this session and, Dr. Zafar Chaudhary from Seattle Children, Dr. Sonia, she's from Mayo. And one of the key initiatives that we are talking about is, hey, here is all these AI initiatives that you want to actually do it. But what is the source of the data? What is the validity of the data? What is the richness of the data? What is the format of the data that you need to put together? And where does the data governance comes in? Also, there are things that, we're still trying if you ask 10 different health systems, their initiatives on AI and what are their plans around the governance of AI, policies around AI with the data, there is no one standard answer that
they'd all be different.
And we
and
are
a year
all,
from now, they'd all be even different
exactly.
again.
And and we are going to go through that, right? We are going to, all of us, we are learning, all of us, we are trying to actually make sure we are pushing it to become like a standard thing. But today, there are different initiatives. Everyone is trying to do different things. I also feel like this session is more to talk about how to get ready with your AI initiatives. Or even if you have AI initiatives, what are some of the things that you may have not looked at for your other future initiatives? So I'm pretty excited about it, and there's some real examples both of them are going to share. And I'm fortunate enough that HIMS selected that session, and I'm moderating it.
That's awesome. So what do you think's next for LK under your leadership? Where are you kind of headed?
So LK as a company, as I mentioned, we are trying to get towards becoming the enterprise data management company. We are sitting on almost 180 million unique patient data in our cloud.
Amazing.
And we're doing more and more work. But the key thing here is that, we are looking at what are some of the things that we are doing today. Maybe in a year or 2 years, they may not be needed. So, we are preparing ourselves for that future, which is like anything, everything around data and interoperability. LK is the company that you should call.
That's awesome. What a great vision. And I think I've heard CIOs say what a great partner LK is in their data efforts. So I think that's great. Any final thoughts for healthcare leaders that are watching? I know you interact with so many of them. Like you said, we're always at the conferences together. You're always talking with the other leaders. Any final thoughts for these leaders out there?
I feel like, one of the key things one can do is listen and learn. And, have a long-term vision in whatever you are trying to do. I also feel like we have so many good partners, customers. They are my everyday focus group. And I feel like they have no problem telling us what will work, what will not work. And that has been a differentiator for us. And I hope that can be a differentiator with others too. And the important piece is networking, collaborating.
Sure.
We all have a responsibility to take healthcare and healthcare IT also towards that next phase. And it's our responsibility to keep doing that and keep helping each other.
That's awesome. Well, Ajay, I'm glad we finally had you on the show.
Yeah.
I appreciate you sharing your insights and perspectives, and congratulations on the new role at LK and all the work that you're doing. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Ajay.
Thank you, John.